And in spite of that, she's over respiratory care and pharmacy. Got a heavy responsibility. She's a very heavy hitter, gets jobs done, and does a remarkable job at Mercy with administration and the quality of patient care. She's been heavily involved in ICU and critical care nursing. She's certified as a critical care nurse and has spent much time there. She also has been involved with Walsh University to earn her master's degree in education and management. So she's had teaching and leadership roles for some time, and I'm very proud to introduce her, and I'm very grateful for her to give up her time on a Sunday afternoon for the benefit of all of you, and I'm sure you will enjoy her. Thank you.
First of all, I want to say congratulations on being here today, because I think it really emphasizes that you have great interest in what you want to do in your future. So, and I also understand it's a very scary time in your life, trying to figure out at a very young age what you want to do for the rest of your life. Okay, so it is I applaud you for being here. Like Dr. King said, I'm going to review with you the nursing profession and basically the introductory steps on how to get there. And we can talk about, and please at any time if you have any questions, just just raise your hand and we can go through that. But in your packet, on the right hand side, I put a PowerPoint together to talk about nursing as a career path. Okay? And also, I just really want to emphasize that it's not the pure definition of nursing, but it is a blend of science and technology. And the use of technology today, just over the last 5 years, has just skyrocketed. And I can't even imagine what it will be 10 years from now. So technology is huge. But also, we take that science and technology and we blend it with the art of caring and compassion. Okay, so anyone entering the healthcare field, whether it be nursing, whether it be therapy, pharmacy, respiratory therapy, you really do have to have the ability to care and to demonstrate compassion to people who are in need. We don't see people in the healthcare profession at their best time, okay? What do you think happens when people are sick and have a major accident? What do you think happens to them? Pardon me?
They're not happy.
They're not happy. Okay, what else?
They're scared.
They're scared. They're scared because we're taking them from their home environment that we know very well, and we're putting them into a very scary environment. It can be, but so it's the healthcare workers' role as professionals to really help them along. And we do that by knowing the science, the technology, but also being caring and compassionate people, okay? So on the next page it says nursing is also known as a science that requires in-depth knowledge in regards to a person's biological needs. I always stress to nurses every day that we are professionals, okay? And we serve as the advocates for patients and families. Patients come to the hospital primarily for nursing care. Physicians, therapists are in and out of the room. Physicians might come see their patients. They see their patients, do their assessments, write their orders, and nurses then make sure that they're continuing and caring for those patients 24/7, okay? And we have to collaborate as a team with therapists, like Elvin's going to explain to you, and respiratory therapists and pharmacists and other doctors. So it's very important that nurses have all of those abilities. So how long does it take to become a nurse? Okay, there's different programs out there. There's a 2-year program, which is called an associate's degree program, or ADN. You'll hear the initials thrown around quite a bit. There's really only one 2-year program left in our area, and that's out at Stark State College. So that's our only 2-year program in the area. The remaining are BSN programs, which are the 4-year program. It's a Bachelor of Science degree in nursing. This is the preferred degree today to get. I'm not saying that you won't get hired with an associate's degree. However, more and more facilities, healthcare facilities, the preference is that you do have a bachelor's degree in nursing. So my advice would be to really pursue that 4-year degree in nursing, because as time goes on, we're going to see that it's almost going to become a requirement. There are nurses out there that have what we used to call a 3-year diploma degree. That's what my original nursing background was a school of nursing, which used to be attached to the hospitals. So those have closed over the last probably 20 years. Those are all closed now. All of the nursing programs are affiliated right with the colleges. We are very, very blessed in this area to have very good nursing programs. We have Walsh University, Malone, Stark State, Kent State campus, Stark State College, like I mentioned. We just have very, very good programs. Akron University isn't too far. So there is a lot of searching that you have to do and some shopping into what program would fit you best, okay? But we do have really good programs here, just locally. On the next page it says high school students, what courses should be taken? I thought it might be good to kind of emphasize the things that you need to be thinking about with your guidance counselor. English, of course, nurses have to be able to communicate. We have to be able to talk in groups. We have to be able to talk one-on-one. We have to be able to talk to our patients. The family members are so important. Patients don't stay in the hospital very long today. So we have to make sure that family members or whoever's caring for the patient, once they leave our facility, that they're cared for appropriately. So that means a lot of teaching and talking to patients and family members. We have to be able to talk to our team members and coworkers and doctors. So it's really important that we have good communication skills, and that starts with basic English. Math, 4 years of math. Science, usually 3 to 4 years. Highly recommend that you take anatomy and physiology course in high school. A lot of times there's advanced placement courses for those as well. I would highly recommend that. I've had just 2 nephews and a niece that just have completed or in the process of completing their nursing degrees, and they all were able to take A&P in high school, which was a very big help, because once you get into college, things really move a lot faster. So it's really good that you have a very solid foundation with A&P and the sciences and math. Now, you don't have to be a math major, okay? A lot of people get scared because they think, I'm not really strong in math. But where it's very beneficial is mostly algebra is what's used. It's finding X, okay, for the math that we use in nursing. Okay, so if you're good at algebra and you can do that, that's your basic foundation with math in nursing. Foreign language is good to have. Usually 2 years is recommended. A lot of the schools offer Spanish. I know at Walsh University, they actually require in the nursing program now that you take 1 year of Spanish. Social studies and computer science. Computer science is really becoming, something that we have to be very familiar with. All of our records, for the most part, are electronic now. Not everything, but we're moving in that direction, and I would guess over the next 5 years, we will be completely electronic with all of our records for our patients and families. So nursing program course content. In the nursing program, there is clinical hands-on experience in locations such as hospitals, extended care facilities, clinics, community agencies. We also have experiences in home care. So there will be like a dedicated amount of time in your nursing program to like pediatrics, to like surgery, getting to be involved in surgery. So the program is very fast and intense, but you get a lot of experience as you go through. On the next page, classroom instruction that you're going to receive while you're in nursing school. Basic nutrition, chemistry, usually a whole year of chemistry. Psychology is usually a couple years. The human anatomy and physiology. Pathophysiology is the study of diseases, and there's usually a year dedicated to patho. Microbiology, that's the study of germs. You spend time in a lab looking under a microscope. and understanding what that germ is, and then how do you treat that germ, like with what antibiotic, or how was a certain disease identified based on the germ that was involved. Pharmacology is the study of drugs and medicine. All throughout your nursing program, you will have, it'll build from the first semester of nursing school all the way through. You'll build on the pharmacology knowledge that you have. And believe it or not, drugs, you're constantly learning, you know, because drugs change all the time. I'm sure Dr. King can attest to that, you know, how much has changed over the years with drug therapy. So constantly we see a change. So you won't stop learning in nursing school, okay? It'll keep on going. Communication, and then human growth and development. A lot of people will ask, is nursing school expensive? Well, college in general is somewhat expensive, okay? So community colleges can be the least expensive way to go. A 4-year BSN programs are more expensive. However, like I said earlier, the BSN is going to be the preferred degree for your nursing career. And it'll give you more flexibility later on in your career if you do have that 4-year degree. But be sure to shop around for the best program, or the program that fits you the best. You know, if you're somebody that really wants that experience of living on campus, take a look at that. If you're going to be someone that is not going to choose to live on campus, going to commute back and forth, then another program might be better. Did you have a question? Oh, okay, but yeah, sorry about that. So also, when you're shopping, always ask the question about, you know, ask the program or the guidance counselor that you would be working with, what is the state board percentage of passing? You know, that's important, because once you graduate from college, you'll be required to take a state board exam. And it really is not too beneficial to go to a school that has a low passing rate. Okay, so luckily in this area, all of the schools have a very, very high passing rate and do a very good job that way. And most of the time, if schools don't do a very good job in getting a high passing rate, they will actually be placed on probation with the state, and they'll have to have action plans to increase their passing rate. So that's just something to really investigate. Also, you know, if you're somebody that really would prefer smaller class sizes, you may want to ask about that as well, so that there'd be more time that you could spend with a professor. Sometimes if you go to large universities like the Ohio State University, my niece went to occupational therapy school there, and there were times that she had 300 people in her class with her. So those are things that you need to think about. What's the best fit for you, okay? And those are things you want to ask. How do I pay for nursing school? I heard out there earlier, you know, there are loans, student loans, there's grants. There are lots of scholarships in the Stark County area. I gained experience with this with my nephew when we were applying for school, and he was very fortunate because we applied for everything that we could apply for. And, you know, anything that you qualify for, go online, look it up. There are many, many opportunities just right here in Stark County for multiple scholarships. The David Foundation has great scholarships if you meet the criteria for that. So that's one I would highly recommend that you look at. If you meet the criteria and keep your grade point average up, it's like $5,500 a year that you would qualify with that scholarship. And I think they give out about 80 to 90 scholarships a year. And they try to hit almost every school district in Stark County. So look it up, work with your guidance counselor. There's multiple ways to help get funding to get through school. Many of the colleges also have you know, opportunities for work programs and etc. So those are all the things that you can do. But you have to do your homework. You really do have to do your homework. You have to do the work to fill out the application. It might ask you to write a narrative about and answer certain questions. But you know what? You need to take that time in order to earn the scholarship. So what happens after college? after graduating from college, like I said, all nurses are required to take a state board exam. It's called the NCLEX. And it stands for National Council of Licensure Examination. After passing the exam, then you can use the initial RN behind your name. You can't use RN behind your name until you pass the exam. Even if you successfully graduated with a BSN, okay, you can't do that until you take the exam. And usually you take the exam around 2 to 3 months. Right now there's students taking the exam and they're waiting to get their results so then they can start their job. Okay, so that's kind of the progress. You cannot start working as an RN until you pass the exam. So, yes.
So what happens if you don't pass it the first time?
And that's a good question. There are students that don't. You can retake the state board exam. And basically there are good programs out there that the state or the school that you graduate from, they will assist you. Walsh and Malone both have very good programs for students who are not successful. It doesn't mean you're a failure, okay? I know some very, very good nurses who didn't pass the state board on their first try, and most of it was due to test anxiety, that they just got themselves so crazy, you know, prior to taking the test. So there are study programs that the school that you graduated from puts together, and then they have you can't take it for, I think there's like 8 weeks you have to at least wait, so that you can kind of get yourself together and then, you know, kind of re-emphasize some studying and stuff. But you can retake it. You can even, if you don't pass it the second time, you can retake it until you pass, okay? So that's one thing I know that kind of like freaks people out sometimes is the state board exam. But after you pass your state board exam, then it's time to apply for a position. And I get this question all the time, is nursing a good profession for men? Okay? And yes, absolutely it is. More men are entering the nursing profession today than ever before. And we welcome men into the nursing profession, and it's really nice to see more men in the profession, especially in, I've noticed that men in nursing seem to gravitate to certain areas. The emergency department, the OR, okay, in the operating room, the intensive care unit. That seems to be the areas that they gravitate. Not that most of them don't go to the OB and deliver babies, okay? They don't want to do that. So, but they have to go through that whole phase during school. But those are the areas that I see men really gravitating to. But we do welcome men in nursing, and I actually encourage men to go into nursing. So I think years ago there was more of a stigma about that, but that's pretty much gone, okay? Characteristics required of a nurse: dependability. Reliable and responsible person, and I put in parentheses there, nurses don't get snow days, okay? You might laugh about that, but actually a snow day is a day that I hate, okay? Because think about what happens on a snow day. You know, many nurses are, you know, parents, and, you know, they can't find babysitting and etc. So what happens? They have to call off, you know. So plan. You know, if you think there's going to be a snow day, then we have to plan ahead. Okay, because what do you think happens, you know, if nurses and healthcare workers, not just nurses, what if they don't show up to work? Their patients don't get served. It impacts patient care. So I can't stress enough dependability and reliability, showing up to work, being on time, and doing a great job. Not just a good job, you have to do a great job, okay? Integrity, honest and ethical. Do you think errors happen in healthcare? Do you think we make mistakes? Okay, and it doesn't feel good to make a mistake. Okay, it's probably the worst feeling a healthcare worker can have, especially nursing. But we have to be honest about our mistakes, and we have to face up to our mistakes, and we have to learn from them. Okay, that's the best way to learn sometimes, is, you know, from mistakes, and grow from those. Self-control, be able to maintain composure. You have concern for others and cooperation, the ability to get along with multiple types of people and multiple personalities. Flexibility, open to change, positive or negative. Attention to detail. You have to be thorough in completing your task. You have to have a stress tolerance, because you're gonna deal with issues, you're gonna deal with people, and you need to do it calmly. And the customer, our patients are customers, and the patient family members are customers, and they're always right, okay? So we always gotta keep that in the back of our mind, and we have to be able to deal with it. And you might feel like rolling your eyes sometimes, or just turning away and walking away, but that's not what we do, okay? We have to try to solve the problem and solve the issue. Initiative, you've got to have a lot of initiatives and willingness to take on responsibilities and challenges. And you're not going to graduate from a nursing school or any healthcare provider type of discipline and graduate and think that you're done learning. I still learn every day, okay? So you really have to be open to that and open to change and the willingness to learn all the time. Specific work activities required of a nurse: assisting and caring for others, documenting and recording information. You have to be a great listener, okay, and be able to take things in and to understand what's going on around you. Listening skills, ability to organize, plan, and prioritize your work. Ability to make quick decisions and solve problems. Establish and maintain interpersonal relationships. And those are just some of the characteristics, but I think ones that I think that are very important. Everybody always asks, how much money am I going to make? Okay, so wage and employment trends. The average RN earnings are between $60,000 to $85,000 a year, and also there's opportunities in some RN roles to earn a higher wage. Okay, so that's just kind of a general rule of thumb right now. There's a lot of advanced practice degrees, and what's that mean? There's a master's prepared after you get your BSN. You graduate from BSN school, you get maybe a year or two of experience, and now you're thinking, okay, what do I want to do with this, basic education that I've received? You can work you can be very happy with having your BSN, okay? Or you can say, you know what, I want to even do more. So maybe I'm thinking about nurse practitioner. Have you heard about nurse practitioners? Okay. There's all kinds of roles with nurse practitioners. There's the acute care nurse practitioner, that's more critical care. There's family nurse practitioner. Okay, family nurse practitioner is from birth to death. Okay, they really take care of everything. There's the midwife who helps deliver babies, certified nurse midwife. There's OB nurse practitioner. She doesn't deliver babies, but they help with the whole OBGYN piece. And then there's the nurse anesthetist, a CRNA. So they help the anesthesiologist put people to sleep prior to surgery and help them recover. So there's all kinds of different advanced practice. Yes?
Do you think that it's better to get your RN and then work and get the experience for about a few years and then go back to get your master's in nursing?
You have to get your BSN first, okay? And then, yes, most of the advanced practice roles require you to have probably a minimum of 2 years working. So say if you want to be a family nurse practitioner, they want you to at least work 2 years like on a medical surgical unit in a hospital. Okay, so you have to get your bachelor's degree, work a year or two, and then go back for your master's degree or nurse practitioner. And then there's administrative roles, like what I'm doing now also requires you to have a master's degree and some other experience with it. My career has just built. I had no idea this is the role I would be in today. That wasn't anything that I aspired to do. It just kind of happened. So, and that's what happens sometimes, in your careers. So, and I'm in a good place, but it's just 13, 15 years ago, this is not what I told you I would have been doing. So, that's how you just kind of constantly learn.
And Barb,
Yes.
what would you say the salary range is for a certified RN anesthetist, a nurse anesthetist?
A nurse anesthetist, they're usually making between 90 to 100,000. Okay, that's around the average there. And most of your advanced practice roles are going to climb in salary. Okay, but what do you think as the salary climbs? What else climbs?
School you gotta do.
Amount of school, education, and responsibility. Okay, when you're an advanced practice nurse, you're also responsible for prescribing medications, you're writing orders for patients, and that's something with the BSN we do not do. So the scope of practice changes, okay? And that advanced practice nurse works with the physician with the standard of care agreement, okay? And that physician has to be very comfortable with that nurse practitioner. Okay, so as the salary increases, so does the responsibility. So according to the national polls, okay, nursing is the most respected profession. There's a Gallup poll every single year, except for the year when New York City was attacked, when the towers came down, the firemen became the most respected profession. But before that and after that, nursing is considered one of the most respected professions. So I did put in your packet, there is on the left-hand side, the 100 best things to do with a nursing degree, okay? So you're gonna find there's lots of stuff. You can be a cruise ship nurse, okay? You can be a camp nurse. Yeah, you can work on a cruise ship, because all the cruise ships have hospitals on the lower level. So say you're young, you get out of school, you don't have any real commitments, you want to go work on a cruise ship, you can do that too. Another place that the men seem to gravitate to is to be on a helicopter. Okay, they want to do the major trauma stuff and go out on a helicopter. Okay, burn unit nurse, rehab, traveling nurse. So you're going to see the list kind of goes on and on to kind of give you some ideas. But I thought this would be a good list. A lot of people will also ask me, what about blood? I don't want to, I can't stand the sight of blood. Well, that is one of the things that you'll have to kind of get used to, but I'm not saying that every single day you're going to see blood, okay? Blood guts, that's everybody's worried about, but you're not going to do that. Yes?
Okay, so, like me, I can deal with blood, I can deal with all of that. I don't know if I can deal with putting a needle inside somebody. Like, when you put a needle in them, do you feel it, like, do you personally feel it go in when you put it in them? Or?
Well, what you feel is you feel kind of like a pressure almost. I mean, but it's kind of hard to describe, but you feel like a pressure because you got to go through the skin,
Right.
So with that puncture, you kind of feel that, skin being punctured, but it's like a pressure.
They're so sharp, you barely feel it.
Yeah.
You become like a sneaky Pete. You can get in there.
Yeah. Yeah, it's pretty amazing because you really don't. You can feel it, but it's not that big of a change. Once you get used to it, you can get really good at it. I wouldn't let that scare you. Okay, I really would.
I'm just like, I don't know if I can deal with it.
Yeah, you'll be surprised. You'll be surprised once you start getting into things and different procedures. It's pretty amazing. The things that you think you could never do, you can do.
After you see them 2 or 3 times, you get excited about it. You become a pro.
Yeah, yeah. What other questions do you have? Anything else that?
I have a question. You said you're an RN, get that 2 year experience to get your MSN. Is that right?
Yes, get your BSN, your bachelor's degree, get some experience, 1 to 2 years, and then start your graduate program, okay? And also hospitals in our area, for the most part, when you go back to graduate school, they help with tuition reimbursement as well. Not all of the cost of your graduate program would be paid for, but a portion of it would be helped through your employer. So it's a question you might want to ask when you're on the road of getting employed. Okay.
Does Mercy Medical have any shadowing opportunities for high school students?
We do. We have a shadowing program, and also you have to be, I think you have to be 16 in order to shadow, okay? And we do have programs, and they start usually in January. Have you been involved in that, Eldon?
Yeah, we see some, and it kind of goes in cycles depending on the timing of the year, but it can really be any time of the year. There's not really a class you have to come through, but you just go through our volunteer services.
And another thing that helps, especially nursing students, is that we have a nurse intern program, a nurse aide program, and also an emergency department technician program. Once you start school, nursing school, I highly encourage you. I was an aide all through my nursing program. And what that does is help you get acclimated to the healthcare environment, helps you get used to patients, touching patients, giving a patient their first bath is kind of causes anxiety for people. But if you're in a nurse aid program or a tech program, that really helps you get organized and gets you really exposed to the type of work you're gonna be doing, okay? And some people will decide, yeah, this is great, this is what I really wanna do, but then they also have to decide, you know what, I'm not cut out for this, I need to do something else.
Can you explain what a prison nurse is? Like, what do they do?
A prison nurse, well, just like any other place, you know, prisons have people that get sick, okay? And most big prisons actually have small hospitals, okay? And, you know, the local prison here, like Stark County, you know, jail and that, they bring their patients to our hospital, you know, but many big prisons, you know, they just have a small hospital and they take care of the patients there.
Well, like when it says it's like incredibly hard work and not for the faint of heart, what is that?
Well, what it means there is that you're going to be exposed, obviously people in prison haven't done very good things, okay? So you're going to be exposed to different personalities, people that aren't very nice, may say things to you that are real appropriate. So that's kind of what that means, okay? You got to have really thick skin, okay? Okay. Any other questions?
Thank you very much.
Thank you, thank you.
I was pretty confident that she wouldn't disappoint you. And the second speaker is Eldon Jones. He's a good friend of mine because I had my left knee replaced twice. First time, everything went fine. About 10 weeks later, I had pus in there. I had a bad bug called MRSA. I had to have it cleaned out, new one put in, and I got this put in. So 3 times I went to his place on Webwall Dressler for physical therapy on my knees, and now I'm happy to say they're fine. So Eldon is a real treasure. He's an MA in exercise physiology and a master's, an MBA in business. And he's director of sports medicine and offsite therapies for locations North Canton, Jackson, Lake, and New Philly. He oversees 45 therapists, therapy assistants, athletic trainers that specialize in physical, occupational, and speech therapies for adult and pediatrics. And he's director of adult and pediatric therapy service, sports medicine, health and fitness, cardiopulmonary rehab programs also. He has been around a long time, has terrific experience. He's running a lot of athletic programs. He keeps himself in very good shape. He's one of my role models, but I'm not doing very well. All right, Eldon, thank you.
How many of you have ever had physical therapy yourselves? Oh, so quite a few. So, and that a lot of times is the case where that's how people first get exposed to that whole field, because I know when I was going through school and such, it wasn't even something on the radar. They existed certainly, but it wasn't something I really had any direct awareness of. But physical therapy, kind of like what Barb said with nursing, it mirrors a lot of the same process that you go through nursing, and the same background you'd want to have as a student. So you still follow the sciences and the math. So all that pretty much is a mirror image as you take your career path through high school and then as you go into the college setting. With physical therapy too, just to kind of broaden your scope too, there's physical therapy, there's occupational therapy, and there's speech therapy too. So there's other therapies that, again, follow similar paths depending on the type of patient you want to see. Physical therapy, obviously as the name suggests, deals with the physical nature of anatomy and physiology, your limbs, your joints, all those things are your main focus for the most part. how you walk, how are you able to walk, getting your strength back, getting your flexibility, those kind of aspects. Occupational therapy is such where it deals with trying to get people to be able to do activities of daily living again. And one of the easiest examples is if a patient has a stroke and they have different deficits now where they can't maybe dress themselves, they can't feed themselves very well. And so the occupational therapist will assist them regaining that strength, regaining those motor skills for the simple task that we all take for granted every day, as simple as buttoning a shirt or putting a spoon up to your mouth. So that's their world. And the speech therapist, as the name would suggest, is working on speech. And it's amazing because I also manage, like Dr. King said, pediatric therapies. The speech therapy for children, it's such a high demand, and there's so many children out there that have speech deficits. And again, things that we take for granted and how we make sounds and even the simple thing of swallowing. Some of the children have issues with swallowing, and so the speech therapist can assist with that. So the speech therapist can wear quite a few hats as to what role they play with adults and children. And again, so again, just to give you some perspective of other avenues you can take in the therapy world. Also with therapy, in the therapy world, there's therapy assistants. So the difference between a physical therapist and a physical therapy assistant is really the education you go through. The physical therapy assistant is a 2-year degree. And Stark State here in town is probably one of the better schools in the state, if not in this part of the country. They have a very, very solid program. And again, just as the name would suggest, you assist the physical therapist in performing those exercises, those routines of strengthening and getting gait training. So that's a 2-year degree path that allows you get a license, and then you perform physical therapy under the guidance of the physical therapist. So they oversee your care, and you go to them for care plans so that you know what you should be doing with each respective patient. But it gives you, in some cases, a lot of students will use it as a stepping stone. They'll go, I want to kind of test the waters and see if I like this field, and then they'll go on and get their physical therapy degree. So it does happen that way in many cases. So it does give you somewhat of a starter point. And there's also occupational therapy assistants as well. So those two fields have the assistant option that is, again, only a 2-year degree that might give you an in. Physical therapy, just to stay on that, kind of using Barb's format here, just somewhat, the high school curriculum, pretty much the same path. Math, science, foreign language, all those are the same. Once you get into school, where someone takes a diversion with physical therapy is, the degree now is the requirement, it's a doctorate. And I know that sometimes scares people when they hear that, and oh my gosh, I'm going to have a PhD. Well, it's somewhat along that path, but it's certainly much more school than just maybe 5 years ago. The profession as a whole has added more classroom curriculum as well as real-world clinical experiences. So they've added to that, and therefore they've made it now a doctorate program. In the state of Ohio, there are 10 programs that offer the doctorate program in physical therapy, Walsh being right in our backyard as one of the more local ones, Youngstown State, Cleveland State, Ohio State, University of Dayton, Toledo. There's all schools that provide that doctorate. Yes?
Like which program that's in Ohio would you recommend being like the best?
Well, I don't, like Bart kind of alluded to, the best is what's best for you. And there's a lot of different things that you need to consider when you're looking at any school. Obviously, location, the cost, the environment. I always tell any student, no matter what path you're taking, you need to go onto the campus of the school itself. And sometimes there's just that inherent vibe you get. You sometimes know if you belong there or you don't. And so I think there's nothing like the personal experience versus just reading catalogs or looking online and kind of seeing that they have this degree, okay, I'm gonna go there. I think you have to go on campus, get a feel for what that school has to offer, and then make your decision, somewhat using that as part of your decision making. But to say one school is better than the other, again, Barb alluded to the pass rates. The same thing applies to physical therapy as far as them getting their license, passing the boards. In physical therapy, you have a board exam at the end that you will take as your national licensure examination. Same thing applies. So there really isn't a difference in that sense, but I have Walsh graduates that work for me that are my employees, and I can say hands down they're very, very well prepared. I also have Ohio State grads, University of Toledo, and Youngstown State. So locally I have a lot of, basically Ohio graduates that have all done very well prepared. And we see a lot of students, as part of your curriculum with physical therapy, and really all the therapies, it's not just a classroom part. There's a very, very heavy emphasis on clinical experience. So in many cases, you'll do 4, if not 5 different clinical experiences varying in length, anywhere from 4 to 12 weeks long, where that's your classroom. So you are going to get hands-on experience. So it's not just, I know the book stuff really well, but when you go to a patient, you don't know, the right from the left. So again, it really gives you a lot of truly clinical experiences. So that really, again, I think gives a student a great perspective of applying those talents that you learned in the classroom and really getting to, practice those people skills. Again, I think physical therapy is probably one of the most people skill type professions in healthcare, because you have people, again, coming to you that are in pain or having some issues, and if they can't relate to you, they're not going to trust you, because when you move their arm that has been broken or strained and it hurts and you're telling them it's okay, if they don't trust you, they're not going to let you do that and let them get better. And so there's that rapport you have to get, and so again, you have to be able to engage them and get them to trust you that you know what you're doing. And that really comes, and those are somewhat intangible things that come along with your experiences to your student rotations. So it's a great opportunity with the physical therapy side that, again, you get the classroom, the traditional classroom setting, but you get a lot of hands-on. And so when you're done with your schooling, you really are very well prepared to go out into the real world and kind of apply your skills. So again, it's a great opportunity on someone's part that feels that they want to relate to patients and be able to help them, because physical therapy, again, it's a great opportunity, and you go a lot of different tracks. Barb gave you the 100 things for nursing. I'm not sure if there's 100 physical therapy ones, but you can go in this. I manage directly sports physical therapy, but it wears more hats than just sports. We don't just see athletes, but a lot of students sometimes think, I just want to work with the Browns, I want to work with the Indians or whatever, and that does happen, no question about it. But we also have, the weekend warriors, the guys like myself that go out and run and do stuff, and then they hurt themselves, and then you have to get them back to what they want to do. Or people that are working on the job and they hurt the low back. People that have surgery, children. It goes the whole age spectrum. We see kids from 1 year to 99. It truly goes the whole gambit. So you really you can pick your niche, and that's kind of a beauty of physical therapy too. Physical therapy, as a profession, probably only less than a third work in a hospital setting. The majority of physical therapists work outside of a hospital setting. They work in private practices, they work in clinics, they work with government agencies like the VA. So there's a lot of different opportunities with physical therapy, and probably without any doubt,
you will find a job in any city you go to in the United States for physical therapy. You will never, ever have a issue with finding a job. And as my generation, the baby boomers, are starting to come of age, there's definitely not going to be any shortage of jobs. As you guys get into the profession now, you're in prime time. You're going to be at the right place at the right time, because healthcare in general is going to explode, just with the needs of the people now becoming the senior citizens and all the healthcare needs they're going to have. And people are living longer, and so with all those dynamics, you guys that are picking the healthcare field will be, definitely riding the wave, because you will definitely have a job waiting for you as you finish your schooling. There's no question about it.
Eldon,
Yeah.
can you speak to the question of salary ranges for physical therapists, physical therapy assistants, and other levels?
Yeah. The assistants, again, due to the schooling differences, physical therapy assistants and for the same occupational therapy assistants, they're making somewhere between $40,000 to $50,000 a year in that ballpark. And again, the thing with that is that's subject to your location. What works in Northeast Ohio and LA could be a whole different scale. New York City, all those things are somewhat, when I say a number, it's more Northeast Ohio based. But bigger cities certainly, in most cases, pay more. And then the East Coast, west or east, typically have a higher pay range as well. But Northeast Ohio, you're in the mid-40s more likely. PT, you're probably looking at probably $80,000 to start, in that range. Is pretty typical. So again, that's in our world, in our backyard, that's pretty much a fairly normal starting salary for a physical therapist. Again, realizing that they have a doctorate now, so sometimes there is a little bit of a bump because of all the schooling, but unfortunately it probably doesn't exactly match the extra schooling you have now, but it certainly is a good start. But again, those are all subject to kind of the area you live in. But that's pretty typical for that world. Let me think of other things that Bart covered that again, all the nursing dynamics. There really isn't any advanced practice things with PT. You can get advanced certifications, and that could help you within your job, so that you might get some compensation within your job, or you can get advanced in orthopedics, sports medicine, pediatrics. Those are all advanced practice certifications you can receive, and it's more of a confirmation of competence, that you have this expertise and you could sell yourself to an employer or a workplace that you have more of a working knowledge of this area of expertise. So therefore you can kind of be more marketable and kind of go out there and do your thing. And in a lot of cases, what physical therapists do, it happens quite often, is that you get some experience for a few years and then you go out on your own. And that's the beauty of physical therapy, is that a lot of people go out and start their own business. You can be your own boss. And that's one of the beauties of physical therapy, is that you can do that. You have the skills and you have the expertise, and they just blend in a little bit of the business side of things, and you can go out and kind of hang out your own shingle and do your own business. And that happens. And there's quite a few in this area, and there's quite a few literally throughout the nation. That is a very, very prevalent pathway that people take with physical therapy, is that you can be your own, and then employ other therapists, and you guys build your practice from there. So it's quite a neat profession. Something that's happened in the state of Ohio, and it's really happened throughout the U.S. Almost, I think there's only maybe 5 states now that don't have it. Patients now can come directly to a physical therapist without seeing a physician first, which is kind of a new trend. They call it direct access. And so you really bear a lot of responsibility where a patient comes to you and says, my ankle hurts, my knee hurts, my back hurts, and you don't have, in this case, the doctor to kind of tell you what is going on. You have to be able to tell that. So that's a lot of responsibility for a physical therapist to do that. And so that practice is out there. It's kind of subject to the comfort level of the therapist, how much that happens, but it's certainly legally an option that you have. But again, it just kind of bears to the amount of expertise that has been given to the physical therapy practice. And so therefore, it really tells you a lot about the expertise and the educational background that you guys go through to get to that point where you can see patients directly without a physician being initially involved in that process. So that is definitely something that's, again, kind of bears witness to telling you that you, again, have a lot of expertise. Yeah.
Maybe you covered this, but just to reemphasize, how many years to become a physical therapist versus a PTA?
PTA is 2-year degree, and now the physical therapist, it's probably pushing 6. Some programs, their formats are different, but they have where you'll go through 3 years of undergraduate and then the 3 years of graduate, which is, so it's kind of almost like you're going through a partial undergrad and then you're getting a master's and a doctorate kind of blended in, and they squeeze it all together in a 5 or 6 year span of time. So you're almost minimum would be 5 years of college. It's more realistically, it's going to be 6 is the time you're going to be spending. So that's pretty much the window of time, no matter what school you go to, just how they package it. But more likely, it's going to be a 6-year process. Yes.
You said how like some GTs go open their own clinic.
Mm-hmm.
If that were to happen, like how much do you think their salary would raise since they have their own?
Well, it could go up fairly significantly, but with that, you have all the expenses. Now you have a building, you have equipment, you have to pay for insurance, you have, if you have other employees, that salary comes out of that pot. So the opportunity for increased salary is immense, but with it comes a lot of responsibility. With other, now people depending on you as a business owner to make things work. And again, all the, as they call it, overhead, those expenses that come with owning or operating a business. Like in a hospital setting, I don't directly worry about that. I know I'm going to have a building with lights and heat and air conditioning, and I don't have to worry about that bill. But as you, as an individual private, practice owner, that is you have to worry about who's going to remove the snow, who's going to cut the grass, and all those things that in other settings you kind of take for granted, but now they're on your plate.
You got to worry about Medicare, Blue Cross, and all the different insurance programs, and hope that they pay you too.
Right, and so it just, there's a lot of other responsibilities, but it's kind of a risk-reward thing. So if you're able to say, I know what I'm getting into, and I think I can make that happen, then the sky's the limit in the sense of the opportunity for salary. Absolutely. I mean, you can make all kinds of money, but again, it comes with the responsibility of, like all the things I said, the overhead and other staff and things that go with that. So you have to wear a lot of hats, and a lot of times what happens with a private practice therapy owner is that they don't get to practice as much therapy because they're doing all the business things.
Yeah.
So you lose maybe some of the things you got into the profession to begin with. You don't get that opportunity now because you have to worry about, paying taxes or, buying new equipment, or who's gonna, fix this piece of equipment. So it's a balancing act. It truly is. So. Any other questions about therapy in general? And another thing, I guess, it's not maybe directly physical therapy, but it's another avenue that people somewhat take is athletic training. is another one, just throwing it out there, as one that kind of follows a similar pathway. And again, athletic training, as the name suggests, you're working with athletes, but it's working in a lot of the same settings as a physical therapist does. We employ quite a few athletic trainers that work in various schools, but also they work in a clinic. So they treat patients just as a therapy assistant does, or a physical therapist. Certain niche of patients, certainly, but again, athletic training is such that is another opportunity that if you would like that kind of world, there's a chance to have another pathway to get into. Usually, and again, athletic training, it's now become a master's program. So that's another parallel profession that might be something on your radar. Yes?
Well, since athletic training and physical therapy are very similar, are you able to be a physical therapist and an athletic
Yes.
trainer at the same time?
Yes, I employ one that has done that. She started out as an athletic trainer and basically went immediately into PT school and piggybacked right into it and has both. So yes, you can do both, and it actually is quite an asset because you know the athletic side of things very, very well, in addition to the physical therapy thing. So her scope is athletes to all types of patients, but she really is an expert on the athletic side when we have athletes that need therapy or post-surgical situations. She's very much an asset because she has that extra advantage of having that degree and having that background. So it's definitely, it's a very marketable combination, very marketable, because you really are truly an expert in that world. So more school, obviously, but if it's something you really like and very passionate about, it would be definitely a great combo.
Do you know approximately how much more school it would be?
Well, if you did the, again, with athletic training, it's a master, so there's 5 years, pushing 6. And with the PT part, you're probably going to have to do at least 2 more years of the PT school to complement the undergrad part. So you're probably talking 7 years at the minimum of school that you're putting in, maybe pushing 8. So yeah, it's almost like going to med school. So it's a lot. It's a lot. Again, it just, sometimes those rare circumstances present themselves that you can take advantage of that, but it's not the normal path, and that's not something that you really need to do, but again, certain people have found the opportunity to put it together, but it's not your typical scenario. More often than not, students should go through the physical therapy realm. And again, after that, similar to nursing, you graduate, you take your exam, and then you become, there's another somewhat perfunctory exam you take for each respective state, and you become licensed in that respective state, and you're good to go. And then if you go to other states, each state has their own requirements, but more often than not, they're fairly comparable, so it isn't like you have to go through any more schooling, but you have to take an exam and go through some of those formalities. But each state has their own licensure requirements, and people can go through that. So you would have to, if you would go from Ohio to Pennsylvania to Illinois, et cetera, you would have to have a license for each respective state to keep that active. And with that too, you have to do continuing education to keep your license active. Physical therapists are required to do 12 hours of seminars, educational sessions each year for their license to become or stay active. So that's a requirement you have. So, like Bart said, you're always learning. You're always learning, and that's healthcare in general. Healthcare is changing so dramatically every year, and this is no exception. You really have to kind of stay on your toes, and this allows you to expand your horizons and expertise. Any other thoughts or questions that I can help you with?
Thank you, Elton.
Thank you. Do you have a question?
Is there, like shadowing opportunities for physical therapy?
There is, same as nursing, yes. So we coordinate that through our volunteer service department at the hospital. And in most schools, for you to apply, they require that you put in so many hours. Some are, depending on the school, it's usually 20 to 25 hours. They want you to have some prior shadowing experience, so you kind of know what you're getting into. So that's almost always a requirement as part of the application process. So yes, we definitely have, make provisions for students to come through and kind of spend a day in the life and kind of see what it's all about, and allow you to see it up close and ask questions and kind of see what the real world part of it. So yeah, definitely would be an option.
So you said like you have to have 20 hours like before you come?
Before you would apply to school
Oh, yeah.
in college. Yeah, not come to us.
Okay.
No, we're giving you those hours.
Letting you work.
That's right, yeah. You just